We were just going along. And for those who didn't have insurance, they just suffered along. So what is the Affordable Care Act going to do overall? And I just give you these 4 points as we have these outstanding panelists who will present to us a wonderful story. This law lowers the cost of health care for women and increases access to quality health care and pays attention to the distinct health needs of women and families. Before the ACA, women have not always had access to the health care they needed or the freedom to make the best health care choices for themselves and their families. As I indicated, women have often been charged more than men for the exact same health coverage. Women had paid higher premiums and out-of-pocket costs. Women tend to make less than men and have a harder time paying for health care insurance. Women, of course, take time off of childbearing. Women, of course, sometimes are heads of households. Women, of course, have to deal with providing care for their children. And sometimes their children have pre-existing disease or conditions, which then deny their children at birth. For children born with sickle cell, children who were diagnosed with asthma became ineligible in years past. What did I say? Living in ignorance. In years past, they were ineligible. Can you imagine that a condition of a human being who has great potential disallows them from getting health care, and they needed it? And so the Affordable Health Care will remove these burdens and obstacles by requiring most health plans and insurance policies to cover recommended preventative services at no additional cost, so that each year a woman can have a well-woman visit with her doctor at no cost to her. How many have heard the stories from women who work from sun up to sunset, who take care of children, and whose doctor says, you came a little too late? If you had just come a couple of months ago, or if she had access to an annual wellness exam, what a difference it would make. Providing the women to get free screenings for breast and cervical cancer, FDA-approved contraception, breastfeeding support and equipment, screening and counseling for domestic violence, smoking cessation medications and services, and added scholarship money for doctors and nurses. Yesterday, we visited with the Memorial System where members of Congress have provided monies for the Advanced Nursing Pilot Program. And to see now the surge